These studies are extremely expensive, and there have been enough good studies done to support our moderate approach, which is looking at balanced foods, vegetables, fruits, grains, and lean meat and dairy products.
The argument, once again, is it has to be tested. When you believe it's wrong, prima facie, you're not going to spend the money to test it.
Why are these nutrition scientists just not more curious about other ideas? You know, I was at a conference recently where we talked about a low-carb study where they reversed the diagnosis of diabetes it was a large university-based study, in just 1 year on a very low-carb diet. And not one of them said, wait, what? Diabetes reversal? Wow, how'd you do that? Can you just explain your study a little bit to us? Because that's what we, as nutrition experts, we really need to do in America. And I actually got up to ask a question from the audience. I said, you know, did you hear that? That was 60% reversal of diabetes. Should that not be headline news? And should you not be curious? Why are you not even curious about these ideas?
You know, it makes you think of stories like the McKenzie family, parents in South Dakota who realized they have to take matters into their own hands when their son lost 5 pounds in 5 days.
I called the doctor that morning and I explained that I thought my son had rapidly lost weight and something was wrong. And we knew within 5 minutes of him doing a urinalysis test that there was sugar in his urine. And we were escorted to the hospital to learn how to manage our new life.
We both concluded that we were going to make drastic changes in our diet, reducing carbohydrate intake. Shortly thereafter, we were told that we didn't need to do that we could feed our son, recently diagnosed with type 1 diabetes, whatever he wanted to eat.
Take a look.
Oh, okay. I'm trusting these people who are now in charge of caring for my son, and they're telling me, give him pancakes and give him French fries and cupcakes and pizza, because now that your kid has this disease, his life is pretty crummy already. And the worst thing you could do as a parent is to try and change his food. I fed my kid the exact prescribed amount of carbohydrates. I pre-bolused his insulin. I put a continuous glucose monitor on him. I bought him a diabetes alert dog. I literally did everything in my own capacity to follow the guidelines and manage his disease, and I failed miserably.
Riv, do you want the yogurt, the tablets, or the gel?
I put a big message out in the social media groups that I'm connected to in the diabetes community, and I asked, how are you people achieving normal blood sugars? What are you doing? And about every 5th answer I got was that these people were changing their children's diet and implementing a very, very low-carb diet. We removed all the processed carbs, the flour, the sugar, the grains, the fruit, anything that would spike his blood sugar. And so the next appointment we had with our endocrinologist, I skipped in there like I had won the lottery. Oh my goodness, I stumbled upon a low-carb diet and look at my son's blood sugars. And during that appointment, our very kind-hearted doctor looked at me and told me my son was going to resent me for the rest of his life, that this way of eating is not sustainable, that I'm subjecting my son to an eating disorder, and he also handed me a business card to go see a therapist because he thought maybe I was struggling with some things and had some issues for wanting to do this for my son and to change his diet. And I'm told to follow these guidelines because without those carbohydrates, my child won't grow properly and his brain function will be compromised. So when you're a parent of a type 1 and you're told the American Diabetes Association, this large governing body that must know exactly what we're up against, they're recommending this, that's intimidating.
We either had to make a change or accept mediocre care. I'm an orthopedic surgeon. It seems now as if it's the patients that are trying to make the medical community aware of what they already know, of what the patients know, because they have tried to follow the rules as given to them and they failed. When somebody comes to me with a belief that they tell me, I believe your son is going to do better if you feed them more carbohydrates, I know they're wrong. And when it comes to my son, I'm going to do what I know as opposed to what they believe.
Our son went from taking 45 to 50 units of insulin every day to maybe 15 units of insulin.
If you extrapolate that over every child with this disease, you can understand that that's going to have a marked effect on the profitability of the disease.
I think we underestimate people's ability to make a change. And I think if there were doctors and nurses and dietitians who are willing to give patients that option, I think the face of diabetes would be different.